so that
Yeah,
people,
I'm not good at electronics, so
that
especially when
way,
it comes to online. It just confuses the heck out
yeah, I'll ask Audrey who does
No,
it.
I don't even know. I don't think I got that last one.
No, I think last year we were trying to do some Zoom and stuff, and so this year,
I got pressure on me.
yeah. Every once in a while, I'll stand up here and I'll go like this to make sure it's still good.
It was, and he's gonna go into like Lion House.
Okay. Okay, guys, I'm Jeff from Monahan.
Hi, Jeff.
If you guys are still hungry, we got lots of food. So,
Go ahead, help yourself.
anyway, I'm the manufacturer rep for this device you guys are all familiar with, the Aerobika, right? Who likes the Aerobika? Raise their hands. Audrey was kind enough to invite me. I came last year, and they use quite a bit at this hospital, especially for folks. And you guys are, this feels like a support group. I've done another one like this called the Lung Rangers in Everett, Washington. It's kind of a cool name, and I think it was like 3 times the size. Anyway, so you guys are all familiar with this, and just a quick review. I'm just going to go through this just for really pretty briefly. You guys all use it in your own manner, which is great. And then I'm going to go through some videos and talk about oscillations, because this device is called an OPEP therapy. So it's oscillating positive expiratory pressure.
I have one, but I never use it.
Oh, well, then we got to get you going. Audrey's going to call you every hour.
Yeah, right.
So you can use it just as is it's seen, or you can angle it this way too, like a hamburger. And the whole goal is to big breath in, exhale out, and hold for 2 or 3 seconds, depending on your strength and what you can tolerate. And there's
Don't pass out.
Yeah, don't pass out. If you're getting weak, don't hurt yourself. But there's a resistance valve down here, a resistance lever that you can adjust as needed. So the higher 5 would be the most resistance, 1 would be the least. So that's something to keep an eye on too. And again, folks that are using this at home, how many people have had theirs like for over a year? And you wash it regularly, once a month, once a week, because you can take it apart in 3 pieces, right? So you can take once a year, okay. But it's probably smarter to take it, well, it's up to you guys really, but take it apart and put it in the dishwasher or just rinse it, air dry it. It's very easy to clean. Yep. And then just take it out and air dry it. And all 3 pieces come apart. And at the end of this, we're going to have a contest so you can take it apart the quickest. Put it
Now,
back together.
what is that used for? Because I'm really,
It helps. It's airway clearance and lung expansion, so it's getting up secretions if you need to, or just helping open up your airways and make you breathe better. Who wants to give her a better definition than that? What do you say it does?
because I always use the, what do you call that?
Use incentive spirometer?
No, it's just to open up your airways.
Nebulizer?
Huh?
Nebulizer?
No,
It's
it's a small.
might be an acapella maybe, or
Huh?
it might be a competing device called acapella maybe, or in any matter, we all know how it works and it helps you guys a lot, right? So
It always helps me when I'm having trouble getting air.
Okay.
It opens up my lungs. That's what I use.
Well, you have to get back to Audrey on that. Let me know what it is, because then we can help you. But I would convert over to this if you can. When I have some here, you can take home too. Today. So 3 to 4 times a day. I don't know if you guys are using, like maybe you're sitting home watching a TV show, you put it every commercial before you go to bed in the morning, whatever works best for you and your therapy. So that's a quick kind of overview of the Aerobika, and we can talk more maybe afterwards. If somebody wants to give a little testimonial about their experience with it, that'd be great. But if not, no worries. So that's an overview of the device, the Aerobika. And I'm just going to go through a couple of videos for you guys, and I'm going to talk about oscillations, which maybe we'll define it, and then I'll go through it on this video, and it gives you an idea of what you're doing when you breathe into it. It's actually like a tone or a sound you're making, and this video kind of highlights exactly what an oscillation is. There won't be any test or anything, so you don't have to pay too close attention. So this is somebody that's breathing into a competing device first and then our device. And the key is that all the way through the breath, you're getting that therapy, which is the most important part. So they bring up those secretions and airway clearance.
So the exhale should last 3 seconds, is that what you said?
It would be, yeah, if you can do that, that'd be nice, yeah. But it's not, again, it's up to your muscle strength, you know. But if you can push yourself to do that, 3 to 4 times a day at that, you'll go ahead.
Is this one that thumps?
No, that's different. That's a percussor.
Okay, that's.
Yeah, that's effective too in its own way. So this just shows you a brief video. So that's a competing device, and then here's ours. I'm going to show you that again. So you're getting more oscillations with ours. So, and that's more effective. Bring it up. So that just gives you a little quick and dirty idea what that's doing to your lungs in a positive way. And then this next slide is just some testimonials from people at conferences, and you can relate to this probably. Maybe this can help you a little bit too, as far as how you want to describe things or how you see things as well.
We've had the Aerobika in the hospital for about 3 years now, and I honestly can't say we've had a patient that it didn't benefit. The first treatment, they respond to it.
We would give these out to patients, have them take it home. When they did come back in, they always brought it back with them. They're like, I use this every day, and it's great, and I breathe so much better after my treatment.
I think it's one of the best airway clearances for a patient.
It has really been a game changer since my mom started on the Aerobika, and we've actually not hospitalized her since November of 2014. So we're coming up on 2 years. So to go from where we were to where we are is amazing.
Giving them the right tools at home to use was very, very important, and that makes a whole lot of difference.
Compliance is essential because if they're not taking it correctly, then they're not going to get the medication.
We're helping patients get better faster, and it shows up in their quality of life. We want them to have the best patient care with the best equipment and technology that we have. Aerobika has that.
You guys have any questions? That's just a little testimonial. Yeah.
So when you're blowing, how many times, you say 3 or 4 times a day, but how many times do you blow in per section?
Ideally, just every time you do it, just take your time, take a big breath in, breathe, try to hold, and it's up to you. You could do it 10 times an hour or 20 times an hour if it really helps you. If you need to just do it once every 6 hours, then that's up to you. But you know your body, so if you wake up and you've got a lot of secretions and you really want to move them fast, hit it hard, and if that doesn't do the trick, obviously you know how the steps go. If you get sick, you got to come in, but sometimes you can work that up with adjusting your resistance to 5, which is the highest, and then just keep working on it, or slowly, gradually work up to that.
I do 30. Each time I use it, I do 30 breaths. Oh, do you really? Yeah, 3 weeks.
That's usually what I
do. Yeah, I do probably between 10 and 10 minutes. I know it works really good.
What is your name? I'm sorry. What's your name?
Cheryl.
You guys got to help Cheryl because she hasn't been using it. So these guys are all here to help you.
That inhaler I was talking about is albuterol.
Yeah, that's a meter dose inhaler.
When I have any issues, but I have no mucus in my lungs hardly ever.
Okay.
So anyway.
Yeah, if you did have that, and maybe after you do your albuterol or before, you could try the.
Well, I only have to use the albuterol maybe once a month, if that.
It's like a rescue.
But I don't wear oxygen just at night.
Oh, okay.
Yeah.
Well, these are all good points, guys. So just, this is kind of open forum. So if you guys want to shout anything, I'm going to do something.
So this device, it works in 2 ways. It helps with the mucus with that oscillating, but it also gives you some positive pressure back to help kind of stick your lungs open. So for you, if you're not having a lot of mucus, you could still probably see benefit if you're using it maybe first thing in the morning to kind of wake your lungs up, open them up and set yourself up for a good day. So I would try doing that in the morning.
Yeah, or I was thinking, if you were to get some kind of a viral infection in your lungs.
Oh, yeah.
Like a cold or, mucus, it's mucus related, but
Totally.
otherwise, I hardly ever have mucus in it at all.
Yeah, totally. I like to tell people that if they're sick, then do it 4 times a day. I usually tell them before breakfast, before lunch, before dinner, and before bed, when you're sick. And then when you're not sick, just regular, doing it a couple times a day. In the morning, wake yourself up.
Okay.
Who's the best position to do it? Laying back in your lounge or sitting straight up? Standing?
I would say sitting straight up
I
probably the
would say
best.
sitting straight up.
But and you remember, you can always do it like this, hold it like a hamburger. You can adjust the mouthpiece so you're, just giving it effort is important as well. I mean, if you are laying down, you can't get up for some reason. So, remember, it's just like going to the gym. You're working out, but you're working on your lungs. So, like Audrey said, like 4 times a day, especially in the morning when maybe there is some buildup in your lungs.
Yeah.
You want to try to open those best you can to help your, and then maybe if you get wheezy or tight, you could go with your inhaler.
I would say just try it and see if you feel like you can do more in the first thing in the morning. Try using it and see if that kind of feels like it opens your lungs up. Because I think it works pretty good for that.
I use it, but I don't have mucus. They told me in the hospital that it's just good for your lungs to make them work a little.
Yeah.
I mean, even if you're not sick,
Okay.
Yeah.
Well, I don't even know where mine is anyway, so.
We got you.
whole pile.
Okay.
We got you new one here. I was going to share one more study that was done at a research hospital that looks at this kind of before and after using our OPEP therapy. I'll just go through that real quick. This is out of Canada, Western University.
The trade name is Aerobika, and it's a device that oscillates when the patient exhales into it. And what that does during the oscillation, you can feel the oscillation into your airways. And what that does is to enable the patient to breathe better. We wanted to verify independently that the fact that this device benefits these type of patients who've got a significant problem, respiratory problem. And accordingly, we went to Western because they had that capability and that expertise. And whatever.
With our technique using high polarized helium-3 gas in MRI, we actually go directly to the source and get structural and functional imaging of the lungs themselves. So using this information, we can get a lot more details and get a lot more differentiation between subjects that otherwise wouldn't be possible based on breathing maneuvers alone.
And this top panel here shows in the 3 views, the coronal, sagittal, and axial, are pre-OPEP images. So this was acquired before the patient actually started using the device. What we can see here is this ventilation defect. And this is actually a defect in the whole right middle lobe. And then we acquired an image again following OPEP treatment. So the subject went home and they used the OPEP device for 3 weeks. And then we acquired this second image here. And now the helium MRI is shown in purple, and we can actually see that this region is now ventilated post-OPEP treatment.
We're really fortunate to have a company like Trudell in London that's a major research and development company that's focused on lung disease. And they have been working tirelessly for years to develop new treatments for lung disease. And at the same time, we've been developing in parallel new ways to look at lung disease. So it really is a match made in heaven. I feel very fortunate to be working on the team.
I want to put you guys to sleep with that. So that just kind of shows a nice pre and post what it can do to your lungs if you're using it correctly. Like most people in here have experienced firsthand, which is great. The oscillation, I can read through a definition if you guys this is just a key feature of the Aerobika device, the back and forth movement or pulsing pressure that occurs when you breathe out through the device. This oscillation is created by the movement of a plastic flap inside the valve cartridge, which moves air through the mouthpiece and generates vibrations. These vibrations help loosen the mucus in your airways and make it easier to clear. So again, these vibrations, and this is just, I think you guys got a kick out of this, so I'll show this again. And these are the vibrations you're hearing. That's what it's doing to your lungs, opening up. That's a competitor. Solid over through. So there you go. That's pretty much all I got for you guys, unless you guys want to chat and have questions. Yep. No, you're great.
So my Bruce over in rehab, he's the one to kind of explain how to use this, right? And but I've gotten some bad habits, I think, because I think he wanted me to just breathe in, breathe out, right? And I've gotten so I go as hard as I can. Is there a good thing for that?
I think that's great, honestly. Yeah, because you're really working your lungs. You know, you're trying to. I think, and it's helping you, right?
Oh, yeah.
Yeah.
The main reason why I'm here today is, unfortunately, I have some throat cancer stuff going on, and I'm going to start radiation and chemo. And they tell me I'm going to build up a lot of mucus, and my throat's going to kind of close and stuff. So I'm hoping that this is going to be, people using this during that.
Well, it's kind of, it can be, I wouldn't say 100% preventative, but it's one of those tools that can help make you stronger, for sure. And your lungs will be stronger, and it's, airway clearance is a big thing. So, I mean, I'm there's no guarantees, but it's great you're doing it though, versus not doing it. Yeah. Does anyone want to share anything about the Aerobika or any other?
I was just gonna make a comment. So, if you're in the clinic or the hospital, you can get one of the Aerobikas. You need one in the clinic. But Norco, if you're outside, if you're not in the clinic, you have to have a prescription. I just found out that recently from Norco. You have to have a doctor write your prescription. And so it's just something to take advantage of here at rehab if it's something that you want, or you have to get it in the RT consultation, or just ask yourself or get you one.
And then in the retail world, like Norco, that's a medical specialty, but this isn't going to be available in like the Walmarts of the world very soon, from my understanding. So we're going to be in the retail side. So again, you'd have to have a script. But if you're just at home and you need one and you can't get it through the hospital, to your point, there's other ways to get it. And you can always call Audrey, or you can go online. Always be careful online though, because you never know.
They're not on Amazon.
Yeah.
Yeah, right? Everything's on Amazon except for Aerobika.
Yeah.
For free.
Yeah, you can get it from St. Luke's Food Gift Valley.
We got, for you guys that came, staff, if you guys want food, there's food up here. I was just gonna get, if anybody wants to volunteer to do a quick testimonial about maybe they've been using it for a while, it's helped them, they have this disease. If not, it's okay. Anyone brave?
Also, we have the ASR team here who wanted to talk about a clinical trial for COPD. So if nobody's wanting to do the testimonial thing with Jeff, then we can have them talk about what they've got going on.
Yeah, it's all good.
They will, I can't remember, but they will go into that. You guys can come up front if you like.
But was that helpful for everybody today?
Yes.
Okay.
I don't want to cut you short.
No, that's great.
You have a 2-for-1 this month. And I brought a whole bunch of Aerobikas up front, so if anybody wants a new one, feel free to grab one. And if I didn't bring enough, let me know and I will bring another one. But anyway, thank
I
you.
got one for you. Merry Christmas.
Yeah.
Yeah, and then Audrey's always available. You can call anytime of day, night. Or two or one.
I'm pretty sure they have the full stuff here.
Yeah. If you've got like symptoms and you feel like you need to, that would work.
All right, looks like Jamie hit all of you with some flyers for our research study. My name is Olivia, I'm a manager at ASR. We do clinical research in Boise, we're in downtown Boise, and my director has been working on COPD studies for the last 15 years or so. So it's something that's near and dear to our heart. Stephanie Canning is our nurse practitioner. She will be working with this current study, and then Jamie is a research coordinator on the study as well. So I'll let Stephanie tell you more about the study itself.
And just so you know, ASR stands for Advanced Specialty Research. We just abbreviate it to make it a little bit easier. Oh, yeah, of course, yes. Sorry. So yes, we're from Advanced Specialty Research. My name is Stephanie. I'm a nurse practitioner, also a sub-investigator. I'm actually at the research site full time, so we're very lucky to have that. That's not always the case. We are overseen by a principal investigator or a medical doctor who watches over all the trials as well in case you have any questions. This particular study for COPD, it's a newish medication. So it basically is an IL-5 or anti-IL-5 biologic. I don't know if you know a lot about biologics, but a lot of them you have to take every day. And so this one is actually given every 26 weeks. So it's an injection under the skin. And the nice thing about this study is you get to stay on your current medication. We aren't taking anybody off their current medication. You can stay on that. You continue working with your physician. One of the requirements for this study is you have to be on triple therapy or a steroid, a long-acting beta agonist, and a long-acting muscarinic agonist. Yeah, so for this study, anyone who's interested does need to be on triple therapy or like Trelegy, because it has to be a steroid, a LABA, and a LAMA, or a long-acting beta agonist, a long-acting muscarinic agonist. But anyone who is on that gets to stay on that therapy in addition to the medication that they're providing. For this one, it is a phase 3, so it's already been tested for safety. Now they're looking at efficacy and trying to compare it to placebo. So some people get the drug, some people do not get the drug. We are all blinded, so we don't know who gets what, just so we can stay unbiased, exactly. So kind of the other parameters, yes.
Yeah, I'm really having trouble hearing you. I don't know what a lot of those words mean anyway.
Yeah.
But my question is, like, I have pulmonary fibrosis.
Okay.
So I'm not on any kind of steroid, any of that kind of stuff. Do I still qualify for this?
Unfortunately, no. That's the thing with research studies is they're very specific in who they're looking for. Has to be a diagnosis of COPD. Without asthma, any childhood asthma is also a disqualifier. Anyone who's been diagnosed in later years, it might not be asthma, and it might have been an early onset of COPD. So anytime we have someone interested in a study, we do ask for medical records, just so we can make sure people are good candidates. If you're not a good candidate, we don't want to have you in the study because it can cause issues with the data and could also be unsafe for you as participants. The thing about research study is everything's voluntary. We do not coerce anyone into it. We have informed consent. There's a lot of oversight with research study, and all of the procedures, all of the tests, all the labs, all of the medication is provided free of charge, and you are actually paid for your time and travel to participate.
Are you guys from a different city? Where are you from?
Boise, downtown Boise.
How long does the study last? It's 1 to 6 months.
So it is, usually most people are 1 to 2 years. It's called a rolling study, and so they kind of keep enrolling until there's our last participant, and whenever they finish the study is kind of when everybody else finishes the study, so it's a commitment of about 1 to 2 years.
Is there an upper age limit?
80, so we're looking at 40 to 80. Mm-hmm.
And how do you volunteer?
So we have brought some new patient paperwork. If you're interested, we asked you to fill it out. We can definitely talk to you more on one if you are interested as well, because with research study, there's a lot that goes into it. But we usually just get information. We keep you on our database. As a research company, we follow HIPAA. So we do not disclose any information, and even the sponsors or whoever funds the study, they do not get your information. It's all kept in-house.
Talk to me about what the medication is.
Yeah, so it's an IL-5 or an anti-IL-5 biologic. Yeah, basically what it is it's, the study is designed for people with type 2 COPD, so it's called eosinophils, so there's more of an allergy component to it, if that makes sense. I think about 40% of people with COPD have this specific type. And so what it does is it goes in and it basically is a biologic, so it reduces that response to the eosinophils, if that makes sense.
So you would feel it, I mean, if you were.
Ideally, yes. And so they've already tested the safety. They're looking at the efficacy. There is something known as the placebo effect as well. And so you can always experience that. But that's what they're trying to find is if people who are on this, they have less exacerbations, so not as many hospitalizations or need for like oral steroids, and just seeing if people can feel better and go longer without having an increase in their symptoms and severity of disease.
And this shot that you get under the skin lasts for how long?
So the injection is given every 26 weeks. Yeah, versus taking it every day. Mm-hmm.
Every day you get the injection?
No, that's usually the oral medications that are given. So this one is to extend it so you aren't having to take something daily. Instead, it's every 26 weeks.
So for people who have high eosinophils on their lab work, that shows a lot of inflammation, and this medication can help knock down the eosinophils in the lab work and help reduce inflammation in the body further than the inhaled steroids. So that's what.
What are you talking about?
Eosinophils is a white blood cell. So if you want them to look at your chart to see if you would qualify for this study, those are the type of people who this would benefit from. And those people have a lot of inflammation in their lungs, often have a lot of mucus too. So that's kind of why I thought this was a good pairing with the Aerobika and your study, because a lot of mucus, a lot of inflammation, and medicated therapy for it, non-medicated therapy for it, kind of hit everybody from both angles.
Are there any other medical conditions that you qualify for?
There are. That would be something we would probably want to collect the paperwork from you and then get your medical records and screen you from there. There is an intensive screening process that we have to put you through over the phone to make sure that you are a good fit for these studies.
Well, okay, I'm specifically talking about rheumatoid arthritis. Because that creates inflammation on its own.
Okay. I do not believe that is one of them.
How about heart issues?
So we do an EKG with this study. We're looking at QT or the length between specific parts of the EKG, so there is a cutoff there.
It's one of those though that like the heart conditions, the EKG would rule something out if there was something that was exclusionary. Then we would tell you at that point that you weren't a good candidate to continue in the study. So we do all that kind of testing before you even get to that point that we're given study drug.
Any other questions for us? Me in the back if you have anything else.
Thank you for having us. Yes. Oh, I was like, I can tell you it's up to $100 per visit, so it's a decent study.
Okay, enjoy your class.
Thank you all for coming.
Yeah, thanks, guys. Nice to meet you.